All right, so we'll go ahead and get started. This meeting is being recorded, so if people who were unable to join on, they will be able to see it later. So hello, everyone. I'm Maddie Dix. I am the Alumni Coordinator for the School of Nursing. I'm excited to welcome you all to our Pitt Nursing Update, part of the School of Nursing's Stay at Homecoming virtual programming. Of course, with the continuance of the threat of COVID-19 and to maintain the safety of our students, faculty, and staff, we've had to make some changes and updates to how we handle things within the School of Nursing. However, even with the difficulties of this new normal, the School of Nursing is still thriving and maintaining their high standard and status. To give you more information on all of the great things that are happening, we will be hearing from Dean Jacqueline Dunbar-Jacob, our fearless leader, as we adjust to these difficult and challenging times. If you have any questions during the presentation, there is a Q&A function at the bottom of your screen, and I will facilitate those after Jackie is done speaking. So without further ado, it is my pleasure to introduce Dean Dunbar-Jacob to discuss the updates to the University of Pittsburgh School of Nursing and present the Lucy Young Kelly Award.
Good afternoon. It's great to have all of you here today to spend our first virtual homecoming. It's a little bit different than we might have imagined, but it seems to work. So I'm really happy that you're here and that we have the opportunity to celebrate the university and to celebrate the School of Nursing at this homecoming time. So I wanted to take a little bit of time to give you an update on the School of Nursing and look both at how we have adjusted to new models of education and work during the pandemic, as well as to give you a broader update on the school itself. So to start with, from a perspective of adjusting to new models of education and new models of work, I would say that our students, faculty, and staff have really adjusted well and have adapted to all the changes that we've experienced, not the least of which is knowing that on any given day we might wake up to some new directions or new strategies. So flexibility has been the order of the day since last March. This spring, we were able to move quickly to remote learning. We were able to graduate 199 seniors, actually slightly early, so that they could get into the workforce sooner and help serve during the pandemic. As many of you may remember, or you may not have been aware, the state issued temporary practice permits to new graduates so that they could get into the workforce prior to taking the licensing examination, as there were constraints on where that licensing examination could be taken. So we graduated 199 in April, and we graduated 54 more students at our August graduation. And we celebrated each of these groups virtually, and we'll be doing that for our December graduation as well. In addition to their classwork, many of the students volunteered at local facilities to help screen visitors. And we had graduate students working in telehealth triage to help mitigate spread and address concerns in skilled nursing facilities as part of the Pennsylvania activities directed to improvement of care and prevention of spread within long-term care facilities. And we had graduate students in pediatrics who worked, again, by way of telehealth with a low-income school district near Pittsburgh on behalf of Children's Hospital Community Services. For the fall and the spring semesters, Pitt moved to what is being called the Pitt Flex instruction. This entails teaching most classes in a combination of on-site, synchronous remote, and asynchronous remote, all at the same time. Large classes that can't be accommodated in person and meet social distancing requirements have moved to an online format. So we just recently, within the last week, in fact, were able to move classes that are small enough to permit social distancing back into the classrooms. But up until this week, the teaching has been done remotely. The Oakland campus has now moved into the guarded phase. And as I mentioned, that means that we can now have some in-person classes. It also means that staff and faculty can return to working in the building again as they deem necessary. We are still encouraging faculty and staff to work remotely to maintain the social distancing that is so important at this point. But individuals can go into their offices episodically as they need to. Our students have been looking forward to being back in the building and to on-site classes, in particular, our undergraduate students, and we're very glad to be able to accommodate them. The students have also been able to participate in clinical experiences. Last spring, we were not able to offer clinical experiences to students from that March through April time period. We were able to get back into the clinical setting in June and to offer our graduate students and our ABSN students the clinical experiences they needed to graduate successfully. And then we were able to offer clinical experiences to students beginning in mid-September, and our students are continuing to learn in the clinical setting, both graduate and undergraduate students. These clinical experiences, as we know, are a large part of why students choose Pitt, and despite all that's going on, we're really happy to be able to continue to provide them with that education. Our spring semester will be somewhat compacted. We will be ending this term earlier than we normally do during the year, although we started early in August, so students have the same amount of time clinically, but we will essentially be ending the day before Thanksgiving. Some online final examinations will be given the week after Thanksgiving. The students will return home for Thanksgiving and come back to the campus on January 20th. So they'll basically have 2 months at home, a 2-month break between semesters. Once they get back, however, they will be back here until graduation in early May, and they will be foregoing their spring break and selected holidays in order to get in the number of days and number of hours of instruction that they need. So we are hoping that we will be able to be back and in the classroom and in the clinical setting, but we'll see where things fall in January. So if we move to the school as a whole, the school continues to be recognized nationally and internationally for its strength in educating students and in conducting world-class research. We continue to be ranked 6th among schools of nursing for research dollars from the National Institutes of Health. And our DNP program is ranked 8th in the nation by US News and World Report. Our MSN program, which now consists of the Clinical Nurse Leader program and an informatics program. So our MSN program is ranked 6th in US News and World Report. And internationally, we have been ranked 16th in the world by QS World University Rankings, and we're extremely proud of our position within the world of nursing education. So including our graduate students and our rising undergraduate classes, we have almost 1,100 students enrolled in the School of Nursing this term. We know that many universities have experienced declines in enrollment, particularly during this COVID period, and we're very happy to report we've had no decline in enrollment at all within the school. We're very excited to learn that over 20% of our students come from underrepresented backgrounds. This has been a growing number over the recent years, and it's just moving in the right direction. We're very, very enthusiastic about that. Our first year class has approximately 175 students, and we're targeting 150 for next year. We target 150 for last year, but we ended up with 175. So we'll see where we end up next year. Our undergraduate population has about 21% from underrepresented backgrounds, and each class has more than the class preceding it. Across the board, our graduates are leaving very well prepared for their careers. We've achieved a 100% certification pass rate for most of our, in fact, all but one of our graduate specialty programs. And that program actually achieved 100% pass rates for those few students who didn't pass the first time. So students are leaving, they're finding strong jobs to springboard their careers. The undergraduate student licensure pass rate this past summer was about 96%, which is absolutely wonderful given the stressors that the students were under and challenges to find a time and place to take the licensing exam. So that worked very well also. So we recently launched our combined Dnp Phd program. And we've done this basically in response to interest among graduate students. We've been finding that we have DNP students who get, as they're learning about translation of evidence to practice, get very enthusiastic about generating some of that evidence. And we're finding among our PhD students that they have an interest in more preparation in nursing itself, both because they may want to work clinically as well as to reinforce the strengths in their research itself. So we have launched a Dnp Phd program. Our first program combines the clinical nurse specialist and the PhD program. And this allows students to concurrently earn both degrees with some credits being shared between programs. So they leave ready to practice as both care providers and nurse scientists with a little bit less time, excuse me, than it would take for those students who have done both degrees independently. We have our nurse practitioner programs sitting at the State Board of Nursing and others ready to go to the State Board of Nursing for approval. We're very enthusiastic about this combined degree. So this summer, we also established our fifth and most recent hub, our Nursing Health Services and Policy Research Hub. As you may remember, we have a hub in sleep and circadian rhythm. We have a hub in genomics. We have a hub in e-health and technology. We have a hub in cancer survivorship. And this is our fifth hub. To generate a hub, we need to have a cadre of individuals doing research in the area. And we create the hub to bring them together so that they can work together, they can learn together, and they can generate research together. So the long-term goal of the Nursing Health Services and Policy Hub is to establish the University of Pittsburgh School of Nursing as an epicenter of policy research by extending the work of researchers who are currently performing health services research within the school, and also to develop new capacities within the school with additional faculty. The hub would build on the resources and expertise of faculty who are currently within the school. Its early efforts plan to focus on understanding and improving the quality, cost, and access to care delivered to individuals with chronic conditions. Right now, focusing especially on major behavioral health conditions. It will also focus specifically on the role of advanced practice providers within primary care and specialty practices toward addressing the needs of patients with chronic conditions. The hub hosts frequent guest speakers from within the University of Pittsburgh and from outside the university, and these are open virtually to the public. So I invite you to join any of those that you might be interested, and you can find the calendar for the hub at calendar.pitt.edu/nursing. So this has been one of the benefits of our having to work remotely, is that we have been able to bring in speakers from outside of the university, and we're able to bring in an audience from outside of the university without worrying about travel. So that basically brings us up to date on the past year at the School of Nursing. And we have one more task for today, and that is to announce the recipient of the Lucy Young Kelly Faculty Leadership Award. For those of you who may not be aware of this, Lucy Young Kelly did pass away this past year. She's been a wonderful alum and a wonderful nursing leader throughout her career, and we certainly miss her and miss the opportunity to interact with her. But she has left us this legacy, the Lucy Young Kelly Faculty Leadership Award. She established the award in 1997, and the faculty award is presented to a School of Nursing faculty member who has demonstrated outstanding leadership qualities and innovative approaches to nursing issues, trends, or learning. And Lucy herself determined the direction of this award. So this year's recipient is Jill Demerci. Her project for this award is entitled Developing High Fidelity, Racially Representative Lactation Education Content for the University of Pittsburgh School of Nursing. Dr. Demerci's program of research focuses on diverse aspects of human lactation with an emphasis on clinical and behavioral interventions to address uptake, duration, and intensity of breastfeeding. She is especially interested in the design and implementation of mHealth breastfeeding support interventions, prevention, and treatment of perceived insufficient milk. So congratulations, Jill, and thank you for joining us today. Even though we couldn't be together in person, it's still always wonderful to see each of you and see your commitment and dedication to the school and to the university. So please offer Jill your congratulations, and thank you for spending part of your Friday with us today.
Awesome. Thank you so much, Jackie. It's so wonderful to hear all of the great things that are happening still at the School of Nursing, even though we're all virtual or mostly virtual, I guess, and it's still maintaining it. I'm so happy to be a part of it. So there were a few questions that popped up. If you have a few moments to just answer them really quickly. One of them was to talk about a little bit about the mental health of the students, faculty, and staff I know that there's been a lot of discussion about the mental health of the students in particular, how the effects of virtual learning has taken, are curious to know about what the School of Nursing and I guess Pitt in general is doing to combat that.
So indeed, there has been an added layer of stress on students, faculty, and staff this year, given the need to make frequent adjustments to what we're doing and how we're doing it, as well as just the overarching anxiety about prevention of the spread of COVID among all of us in our community. I think from the perspective of the students, they have done exceptionally well. The university as a whole has established telehealth counseling sort of on the spot services that are available to students. And we certainly have advised students about the availability of this resource to them. For the most part, though, we're not seeing a real difference in the level of anxiety and depression than we see during the normal year. Yes, a higher level of stress, and that is certainly to be expected. I think it's fair to say the same thing is true for faculty and staff. A higher level of stress, fed by the need for frequent changes, the reduction in social contact as we're all socially distancing, and the challenges of many of our young women faculty and young men faculty and staff who have children at home who are learning remotely. And consequently, the faculty and staff in those situations are both teaching our nursing students on campus and also doing homeschooling at home with their children. So yes, the stress level is higher. I'm not hearing that true mental health conditions are, again, any higher than they are under usual circumstances. I think the staff and the faculty have pulled together to support each other and to offer strategies for coping with some of these issues that add an extra layer of stress to us. At this point, what I'm hearing most is that faculty and staff are tired. Just to sort of go over again, we started the winter term in January last year and ended early, ended at the usual time, but we ended the teaching on site early and had to make a very rapid, like 2-week turnaround to offering the remainder of the term remotely. So there was an incredible investment on the part of the faculty and the staff to get courses transitioned to a remote format. We moved quickly into the summer term, again, continuing to offer courses remotely. And since we were not able to get back into the clinical setting, we offered the didactic courses intensely in the first half of the summer term, and then we offered clinical in the second half. So in addition to getting things done remotely, there was a faster pace with which things needed to be offered over the summer. And then we started the fall term early, so we really did not have a summer break for faculty and staff. And they've been heavily engaged in teaching remotely, and now some return to the classroom. So it's been a long time since there's been a break, and folks are starting to get tired. And I think knowing that classes will end on November 20th, we're a month away, I think is the carrot that is keeping everyone going right at this point.
Yeah, absolutely. The end is near for them. They can see it. I know you talked a little bit about clinicals and how in the spring semester there was a little bit of a lull with clinicals. We weren't able to offer it for March and April, but has there been any major adjustments within the clinical other than, mask wearing and PPE? Has there been any other major adjustments to the clinical settings for the students?
So we've had major adjustments for the clinical courses. So in the spring, since we were not able to get into the clinical agencies between the first part of March and near the end of June, faculty really had to transition their teaching to the utilization of case studies, the generation and utilization of simulation scenarios that could be done remotely, and so on, to give students at least that same cognitive learning that they would get in the clinical setting, even though the performance was not available to them. So there's been an awful lot of continuing generation of simulation, case studies, and so on to build clinical thinking. When we started back in the summer, we were only able to take our students who were graduating this year into clinical. But then when we went back in the fall, we were able to bring everyone back into the clinical setting. However, the clinical agencies reduced the number of hours that they would permit students to be in the clinical setting. They increased the length of the clinical day that students could be in this setting, and they reduced the permitted faculty-student ratios. So it meant, for example, that students going into Med-Surg clinical, instead of having 8 students with 1 faculty member, it was 4 students and has been 4 students with 1 faculty member. We needed to cut the hours in the clinical in half. So students might go in every other week to clinical, and then on the alternate week, they need to have simulation or case study discussion as an element of their clinical. And then their actual clinical hours have been increased. So rather than the 6 to 7 hours the students had been doing before, the day has been lengthened for them. So they are getting more than half of the number of hours, but they're doing it in a different fashion. So those have been multiple adjustments. From the standpoint of the graduate students, basically a reduced number of students in clinical placement facilities, some facilities that have been reluctant to take students at the present time because of their own circumstances or their fear of students, potentially fear of one more person coming into the clinical agency regularly. But we have been able to place all of our students, and they're getting the required hours that they need for graduation.